everybody, today we are going to talk about age and orthodontics, so get ready. I'm Dr. Jen, I'm from Impact Ortho in Calgary, Alberta, and I love making videos to educate you on everything orthodontic. And today what we're going to talk about is age. We get asked the question all the time, am I too old for orthodontics, or is my child too young for orthodontics? So age is a big deal, and we do treat people of all ages. So as young as 5, and as old as 85, even older, I guess, if they came to see me. That's just my oldest patient to date. There are different things we do at different ages, and that's actually the most important thing to understand about orthodontics. There are things that we can do very easily in young children that are very difficult to do in older adults. As an example, if someone has severe crowding, so their teeth are very overlapped, there's just not enough space in their mouth for all of their teeth to fit, it is quite easy to change the shape and size of a young child's mouth. It is impossible to change the shape and size of an adult's mouth without something more invasive like jaw surgery. And so when we have certain problems that we identify in children, we try to treat them younger so that they can get the benefit of the best possible treatment to keep all of their teeth, hopefully, with the least invasive treatment. And so the age that you are at, so your child or you as an adult, just will change how we might fix the problem that is presenting. We do recommend that every single child see an orthodontist when they're 7, because at that age, we can determine what the growth pattern appears to be, what the size of the teeth looks to be, and then we can guide you on when treatment is best needed at that point in time. But truly, anyone can see an orthodontist at any time. Anyone. Consultations in our office are free. You don't even need a referral from your dentist. Anyone can call us or book online on our website or submit a virtual consult on our website, and we'll tell you exactly what's needed. In summary, when kids still have baby teeth, so we'll say under the age of 10, there will be certain things that are beneficial to do at that age if needed. So correcting severe crowding is one. Certain severe types of bite corrections like underbites really do need to be treated when kids are little, because we need the flexibility of the ability to move bone in order to make the bite fit together correctly. Once we get into the teenage years, so anyone who's almost in all their grown-up teeth or pretty close, so we'll say age 10 to 16 or 17. Those are the kind of the teenage adolescent years. Those are prime orthodontic years. If we're doing treatment at that time, if we can, on most people, that's when we're doing it. It's because all teeth are present, but bones are still changing and individuals are still growing. So we have lots of flexibility in what we can do, how we can do it, and how fast we can do it. So most bite corrections, making teeth straight, closing spaces, overbites, underbites, spacing, just about anything you can think of, we can address in those adolescent years. Then once we get older than 16 or 17, especially in girls, maybe over 18 in boys, then we're into what we call adult orthodontic treatment. And this is often when we get asked, am I too old for this? No, you're not too old. The difference is just in what we can accomplish and how long it might take. There are certain movements in young children that are really fast, that can be done in adults, but will just take more time. So something might take 1 year in a 12-year-old, and it might take 2 years in a 45-year-old. It is still possible, it's just going to take more time. There are also some things we can't do in adults. Like I said, we cannot change the size and shape of the bones of your face and jaws because they've already been established, and so there's nothing I can do to change that unless I use an oral surgeon to help me, and we do something to move teeth and bone together. And of course, that's always an option. We have lots of patients that have what's called orthognathic surgery for this type of correction. But otherwise, we always have multiple options. Sometimes we can just make the teeth straight and not correct the bite, especially if it's comfortable and feeling okay for you. Sometimes we'll do things like take teeth out or talk to a surgeon if something is really complicated. Oftentimes in our adults, if we have more crowding than we want in the mouth, and we can't make the bone bigger, but we don't want to pull a tooth out, then what we do is called interproximal reduction, which is just reshaping of the teeth to make them fit into the space that's available. That's very safe for the teeth. It doesn't increase their risk of cavities or anything like that. It simply reshapes the outer layer of enamel by fractions of a millimeter to make the teeth fit into a slightly smaller space than what they were designed to fit in. Like I said, the older you are, still possible. Here's one other thing to keep in mind. There are certain medications that certain older adults may have as they age. And so there are drugs that affect the health of your bones or affect the metabolism of your bones that sometimes will really slow tooth movement down. So if someone is on bisphosphonates, any treatments for osteoporosis, it doesn't mean that they can't have orthodontic treatment, but movement slows down significantly. So the timeline there is far less predictable. So we can often not give an accurate timeline for some of our adults that have complex medical needs because we don't know for sure how fast the teeth will move. It is also possible to do both braces or Invisalign on any single age. So as young as 5, as old as 85, any appliance can be used to move the teeth around. And when you go see your local orthodontist, they'll talk with you specifically about the benefits of either types of appliances, what you have to do at home. The biggest differences, as you guys know if you've watched any of my videos, come down to home care and what you can eat. And so there's often one that feels like a stronger pull. In our office, we do a lot of Invisalign, and we only do custom braces. They're called Light Force if you want to look them up. But both of those are options in our office for patients of all ages. So this is my very long-winded answer to the question, am I too old or too young for orthodontics? Most kids will be treated in their growing puberty years, somewhere between 10 and 16, but there are some issues that really do need to be treated younger for us to get a great result. And adults, all of you are open. We can see any of you at any age, and we'll give you a full breakdown of what is possible and what the limitations might be and what your options are to figure out what's going to suit you best for what your main concern is. Maybe it's just one tooth. Maybe it's everything. We can talk about it, let you know what's possible. Thanks for tuning in, you guys. I'll see you next time. Bye-bye.